some degree of asymmetry is preferred to complete symmetry. So is it like that with the teeth, or would you say that it's better to have them be really totally symmetric and
That's a
perfect?
good question. When we learn to do smile makeovers, and again, I'm very fortunate because I was in a very special program at NYU with the guy that invented veneers, and we had a whole curriculum around aesthetic dentistry. But exactly what you're talking about, facial symmetry, we studied that. So we would actually, for all the cases that we presented in the program,
Mhm.
we would have a certain template that we used, and we would take the person's face, we would take the left side of the face, and copy it, flip it, and put that together as one side. So it would be a perfect symmetry on the other side. And yeah, people looked ridiculous being 100% symmetrical. So when you're building the smile, you also look at the face and the symmetries, and sometimes you even shift the teeth a little bit to compensate, but for the asymmetries in the face.
Yeah. No, that's interesting because I've never read about that or heard about that. We've never discussed that when it comes to dentistry. Yeah, I mean, I find that in almost every single patient of mine, every person, walking this earth has this almost like a bony asymmetry, really, and then the soft tissue really follows suit. So it's the bony structure that's a little bit off from one side to the other. Usually one side's kind of stronger and larger than the other, and then everything else sort of follows that underlying skeleton. So yeah, so that's interesting. So for example, in also talking about the smile, some people say, well, not so much just in a static way, but when they're smiling in a dynamic kind of motion, they find that one side is just kind of higher up, it pulls a little bit more, maybe more of a line forms and nasolabial fold on one side versus the other. And then they're like, well, how do I make that symmetric? Why is that the issue? Well, the muscles on one side are probably stronger than the other, and there's really no great way to make the muscles completely the same because one's just going to be a little bit bulkier. So that's kind of what so just more education than giving them a great treatment, sometimes. So
Well, it's interesting you're talking about the nasolabial folds, and the question is, why is there more pull to one side? Is it muscular? What is that area of the face sitting on? It's sitting on teeth. So if you have a big asymmetry in your teeth where
mhm.
one side is sunken in and the other side is bulky, maybe some teeth are crooked and sticking out, that's going to create asymmetry of the soft tissue that's on top of it. So that's something that can also potentially be corrected through orthodontics, through dentistry, through
Right,
veneers.
right, right, right. Makes sense.